Coming up on this special half-hour edition of HealthLink, it is the leading cause of death in the U.S. The common warning signs to look out for to help prevent cardiovascular disease.
That's when we need to start thinking about, do they need a booster?
Measles cases are on the rise across the country, sparking questions about the MMR vaccine. The guidelines on whether you need a booster.
I mean, it sounds tantalizing to have a mocktail in order to sleep better.
And from melatonin to mocktails, there are a lot of sleep hacks out there, but what really works and what's safe? Thanks for joining us for this special presentation of HealthLink on King 5 Plus. I'm Christine Pei. Our first story will make you think harder about high blood pressure or high cholesterol. Some eye-opening research reveals they could dramatically influence your chances of suffering a serious cardiac event. The new research shows more than 99% of people who suffered a cardiac event like a heart attack or stroke already had a common risk factor.
I had a lifetime of very severe heart disease, which I had mostly ignored and neglected.
Aaron Holm was diagnosed with a genetic condition that caused very high levels of cholesterol in his 20s after a misdiagnosis of heart arrhythmia. For the fit athlete who played volleyball for the University of Toronto, Holm's cholesterol should have been a warning sign, a sign he chose to ignore at the time.
I was just checked out. I tuned out from, I didn't go to a doctor for like 20 years.
For a while, he said he felt his chest clench up during workouts. Then one morning in 2018, he went for a swim in Lake Sammamish.
And it happened in the water and I couldn't reset. And so I thought I was going to die. I thought I was going to drown.
He made it back to shore safely, but decided to see a doctor. Tests later, doctors told him he needed quintuple bypass surgery because of a blockage in his heart. He was only 46 years old at the time.
That's the thing about heart disease is oftentimes it doesn't present. You have people that have issues and they look great. Like they look really healthy. They exercise all the time.
Holmes' case is similar to a global cohort of patients in the study published in the Journal of the American College of Cardiology this fall. It analyzed records of 7,000 U.S. adults and 9 million from South Korea for more than a decade. It concluded that most cardiac events don't strike by complete surprise. 4 precursors like high blood pressure, blood sugar, cholesterol, and smoking went unaddressed before a patient experienced heart disease.
And the more of these risk factors you gather along the pathway of life, the greater your risk later in life of having a heart attack.
Dr. Sarah Speck is a cardiologist and medical director of cardiac rehabilitation at Providence Swedish. She says the first step to prevention is know your numbers.
Know what your cholesterol is, know what your blood pressure is, know what your blood sugar is. These are simple tests that any physician can perform for you.
She adds 80% of heart disease is under our control. Speck recommends a diet rich in fruits, vegetables, and fish, quitting smoking, and being active for even 20 minutes every day, which can translate into a healthier, longer life. For Holm, his cholesterol is now low thanks to medication.
Seek out people who've had the similar experience. So find a way to talk to someone who's been through what you're going through, because you really, you don't have to be alone.
We are in the thick of cold season, and cases of strep throat typically go up in the winter months. A common cold and strep both feel terrible, but they are not the same. Here's how you can tell the difference.
So strep throat is a very common infection that we see in children.
And worth paying attention to. Dr. Elizabeth Mead is a pediatrician at Providence Swedish.
It's an infection that happens in the throat, sometimes the back of the throat, near the tonsils, that sort of area.
Here's the main difference. Strep is a bacterial infection, while a sore throat from a cold or a flu results from a viral infection. Dr. Mead says anything resembling a strep bacterial infection among kids should not be ignored.
It's important that we do treat it if it's there because that can prevent some secondary outcomes that we can see if it's not treated with the correct medications.
Secondary complications can lead to kidney inflammation and rheumatic fever that affects the blood vessels and joints.
It's not very common, but it is something we take into consideration. And so we just always want to make sure that we're treating strep throat if it's there.
So here's what to watch for. Strep throat symptoms typically include noticeable redness in the back of the throat and swollen tonsils. Young children might even have stomach pain. In comparison, regular sore throat symptoms usually come with other flu or cold symptoms.
I think the general tip is if you have symptoms that are really sort of localized to the throat, so it hurts, it's red, you've got swollen lymph nodes, and maybe a fever, but like not much else, that's much more likely to be concerning for strep. If you have a ton of other runny nose, cough, cold symptoms, that's usually not strep throat.
So doctors say strep throat is mostly spread through saliva, so avoid sharing utensils and cups, things like that. If you suspect your child has strep throat, call a doctor for treatment, which is by antibiotics. Well, a spike in measles cases across the country might have you wondering, should I get a measles booster even if I got vaccinated as a kid? I spoke with an infectious diseases expert for the answer. Measles outbreaks in the U.S., including a confirmed case in Washington, has medical circles underlining the importance of measles, mumps, and rubella vaccination among children. But what about adults who got the vaccine decades ago? CDC guidelines say adults who have documentation of MMR vaccination as children should have sufficient immunity. And adults who were born before 1957, regardless of vaccination, are presumed to have natural immunity because of the prevalence of measles at the time.
But for people born after 57 or people who just aren't sure about their immunity or maybe only received one dose of the vaccine, that's when we need to start thinking about, do they need a booster?
Dr. Seth Cohen is the medical director of infection prevention at the UW Medical Center. He says he is noticing more adult patients asking about getting a measles booster.
I would say my colleagues in pediatrics often think about measles much more frequently, but unfortunately, even in adult medicine, now we have to be thinking about it as well. And so I think there is a more general awareness that people may not be immune or there may need to be additional boosters.
Dr. Cohen emphasizes the measles vaccine is highly effective, but with an increase in cases, he says it doesn't hurt to undergo a titer, which is checking antibody levels from a blood test. And if you have travel plans,
there's still a lot of measles out there internationally. And so if you're traveling, it's a great idea to make sure that to go talk to your doctor and make sure that you have enough antibodies in your body to protect you against measles should you come across it.
However, Cohen says pregnant women or those with compromised immune systems should consult with their doctor before pursuing a measles booster. The ultimate concern, doctors say, is how contagious the measles virus is.
It is a very smart virus. And at this point, I am much more concerned or scared about measles than I am about COVID, for example. And COVID is still very serious in our community.
In the year 2000, measles was declared to have elimination status in the U.S., meaning there was no continuous spread of the disease in a span of a year, a status that has in recent years been at risk. Well, we all want to get a good night's rest, but there is a lot of advice out there for better sleep that might not actually work. Here's what a local sleep specialist says about the claims. The quest for a good night's rest is all over social media, oftentimes marked with the hashtag sleepmaxing. From sleepy girl mocktails to special tape to shut the mouth, there's a lot of noise out there on what helps us get better sleep.
A number of these hacks for sleep are pretty standard advice for improving sleep.
But there are some that warrant a closer look. Dr. Brandon Peters-Matthews is a sleep medicine physician at Virginia Mason Franciscan Health, specializing in cognitive behavioral therapy for insomnia. He knows quality sleep matters.
Sleep is a pillar of health. Just like nutrition and exercise, it's the other main contributor to our health and well-being. And so it has its fingers in everything.
First, tackling those special mocktails.
I mean, it sounds tantalizing to have a mocktail in order to sleep better.
They contain ingredients touted for better sleep.
The cherry juice has some melatonin in it. There is some evidence that that can benefit sleep. Also perhaps has some serotonin, which converts into melatonin.
They also call for magnesium, recently receiving some attention for sleep benefits.
So people can find these things to be somewhat helpful. They're fairly harmless to try. And if somebody finds a benefit in having that mocktail, I think that's fine.
Regarding melatonin, one of the more popular sleep supplements in the market,
fairly modest effects on sleep. If you measure objectively how much it changes sleep, there's not a big difference in how people fall asleep or how deeply they sleep.
But Dr. Peters-Matthews says if you like taking it, it shouldn't hurt.
They actually are more effective at low doses, taken even hours before intending to go to bed, to help your circadian rhythm, which will promote healthy sleep.
As for hacks like using tape to seal the mouth to encourage breathing from the nose, Dr. Peters-Matthews says it can be beneficial if people have dry mouth issues, but check with your doctor before trying it.
There are folks who cannot breathe well through their nose because they have a deviated septum, and that's a fixed obstruction to one side. They might not actually tolerate putting tape across their lips. They may wake somewhat panicked and take the tape off. So it's not for everybody, especially folks who feel restricted in breathing through the nose during the day.
And those sleep tracking devices should be used with a grain of salt.
I would say accuracy is not 100% as far as staging sleep and correlating to your sleep.
As for what does work, it's important to recognize how much sleep you really need.
You don't want to spend more time in bed than you're able to sleep. So if you're always getting 7.5 hours of sleep, you don't want to spend 9 hours in bed, or you're going to be awake an hour and a half each night. So it might actually mean keeping a consistent wake time, getting 15 to 30 minutes of sunlight exposure in the morning upon awakening, and then actually delaying your bedtime to build a stronger sleep drive.
So many people opt for white noise devices or apps to get a better night's rest. They have boomed in popularity and are effective at drowning out surrounding noise. Things like a snoring partner, a child in the next room, or outside traffic sounds. But experts say be careful if the white noise is too loud, especially for young children.
So the safe decibel level for white noise in babies is less than 50 decibels, which is equivalent to a quiet refrigerator or a gentle rainfall. So it's fairly quiet. For adults, we generally like to keep it under 70.
He says anything higher at sustained levels can lead to hearing loss over time. Coming up, a game changer for gene therapy. We'll show you the cutting-edge work happening in Seattle to help find cures faster. And you know it as a weight loss drug, but Ozempic could help battle addiction. From drinking to smoking to drug use. We'll take a look at the findings. Plus, could a woman's monthly cycle make them more susceptible to ACL tears? We'll hear from researchers who think it can raise the risk. Welcome back to HealthLink. I'm Christine Pei. Some of our most challenging health conditions result from genetic disorders like sickle cell disease and even certain cancers. Gene therapy is revolutionizing how they're treated, and the Fred Hutch Cancer Center in Seattle is at the center of it all. This is the lab where researchers say the magic happens. You'll see the usual flasks and pipettes, no big deal. But the work being done here is far from ordinary.
That gets me up every morning, to be honest, to be able to think about now how can we really manufacture these treatments to help patients, whether it's genetic diseases or cancer.
Dr. Hans-Peter Kiem is Deputy Director of the Translational Science and Therapeutics Division at Fred Hutch. His specialty is gene therapy and stem cell engineering, specifically for blood cell conditions like sickle cell disease and leukemia.
Gene therapy is to simply correct a defective gene.
His team's work harnesses existing breakthroughs like CRISPR, the gene editing technology that allows scientists to modify DNA at the molecular level. It can be used to correct genetic mutations that cause certain diseases, in this instance, defects in blood stem cells.
Imagine there's letters in the genetic code, just like in the alphabet. And we can now, if there's one letter is wrong, we can fix that letter.
While gene editing has been around for years now, Kiem's work at Fred Hutch follows a specific approach.
Very often gene therapies are being done where we collect the cells, bring them to a facility, and then a very sophisticated procedure needs to be done to modify these cells, again in a specialized laboratory, and then re-infuse the cells into the patient.
But Dr. Kiem's method found a way to simplify the process.
Now, we simply infuse that medicine.
Here's how. His team found a way to package virus-like particles that deliver the DNA fixers to defective cells, ultimately correcting the disease. While the findings are still undergoing clinical trials, it could be a game changer in gene therapy, making it more efficient and accessible. Can we call it a cure?
It is a cure.
Moments like these make Kiem remember the reason why he came to Fred Hutch in the first place decades ago.
And I came here because of Don Thomas, and what we called bone marrow transplantation back then really started everything.
This lab is in the Thomas building, the namesake for Dr. Donald Thomas, a Nobel Prize laureate whose groundbreaking work in bone marrow transplants set the tone for innovation at Fred Hutch, which is celebrating its 50th anniversary this year. Dr. Kiem's findings are setting a new foundation in gene therapy.
I suspect in the next really 5 years there will be a lot of these treatments.
A medication originally designed to treat diabetes is showing unexpected promise in fighting addiction. Medications like Ozempic, already popular for weight loss, may help reduce cravings for alcohol and other substances. Here's what some of the latest research shows. They're known as GLP-1s, short for glucagon-like peptide 1, but commonly recognized as drugs like Ozempic, Wegovy, and Trulicity. Developed in the 1980s, they were originally designed to control blood sugar for diabetes patients. But these patients started reporting something doctors didn't expect. They weren't just eating less, they were drinking less too.
A lot of people talked about the food noise also being the alcohol noise, right? And so when they started to notice that they just weren't drinking as much wine or they just weren't drinking as much beer, they kind of were laughing about it, but they started doing some of these preliminary studies on it.
HealthLink reached out to WSU pharmacotherapy professor Nicole Roden, who specializes in substance use disorders. She says researchers began studying these reports seriously, even analyzing Reddit posts where users shared their experiences.
So that starts that, I guess, pilot data to actually dive deeper into this. So since then, we've been able to find more research on it.
Roden notes that GLP-1 receptors are located throughout the body, including the pancreas, liver, and our brain, where the receptors affect feeling full after eating.
They're also seeing that when people do partake in substance use, whether that's alcohol, cocaine, something else, there is some early reports to say that it's that satiety that might be impacting it. So they don't feel like they need to binge at that moment.
Roden says the discovery shows promise for treating drug addiction, even smoking. Currently, the FDA has not approved GLP-1 medications for addiction treatment, and clinical trials are still in the early stages.
So I don't see this being an overnight sensation or phenomena. With that being said, I think especially if you're already indicated for diabetes or obesity and you're going to be using these medications anyways, it could be an added benefit if that is one of your goals.
Roden estimates it could be 5 to 7 years before these drugs are specifically approved to treat substance use disorders. Researchers emphasize that addiction treatment is not one size fits all, and even if approved, these medications would likely be used alongside other therapies rather than a standalone solution. It is a common injury for athletes that is also one of the most dreaded. ACL tears affect about 1 in 3,500 people a year in the U.S., with some studies showing women are more at risk. And female athletes are also noticing an interesting coincidence. We take a look at why their period might make them more vulnerable to injury.
Okay, so this is how this article starts out.
Seattle athletes Sue Bird and Megan Rapinoe recently brought it up in their podcast, A Touch More.
When I tore my ACL in 1998, it was December of 98, so it was almost 99. But in 1998, nonetheless, the very first question the doctor asked me when I saw the surgeon, are you on your period?
Bird is referring to a coincidence that might not be such a coincidence after all.
This is why funding medical research matters, because then we can really answer these questions.
Dr. Cindy Lin is a clinical professor of sports and spine medicine at UW Medical Center. First, an explanation. ACL is short for anterior cruciate ligament, a rope-like ligament that crosses the center of the knee.
And it helps us to keep that knee stable. Doing activities such as running, jumping, pivoting, or change of direction activities, just like soccer or basketball or playing tennis. But when that rope, the ACL tears, it can lead to an unstable knee.
Such an injury could bench an athlete for months or even a year to fully recover and return to the court or the field. But whether the risk of getting one is at all linked to a woman's monthly period still needs to be confirmed.
Oftentimes, ACL tears are very multifactorial, meaning that it was a combination of other factors happening during play. And that's why it's so important that they're going to study this.
FIFA is funding a study in the UK based out of Kingston University, where researchers will study blood samples from female soccer players during various times of their cycle. Until we get results, what Dr. Lin does know.
Specifically, what's happening is that there's an increase in estrogen around the time of ovulation, which is when the egg is released. And that's believed to be associated with increased looseness of that ligament, right? That looseness of that rope that is strong across the center of our knee. And that might be what's increasing the risk of ACL tears.
Getting a better sense of whether hormones influence a woman's injury risk could help cue an athlete on when to go hard while training or playing and when to take it a little more easy.
By identifying whether there are certain parts of the menstrual cycle that are related to increased injury risk, then we can really start tailoring and individualizing it.
Their first two guesses were that I had either been shot by a nail gun and hadn't told them, or that I was a sewer and I'd swallowed a needle.
Coming up, a local woman lands in the ER all because of a grill brush. The tiny culprit that doctors say poses a potentially life-threatening risk and what you can do to stay safe. Our last story may make you reconsider using a wire brush to clean a grill. If you're not careful, a dislodged bristle, if ingested, can send you to the hospital. I talked with a patient who never saw it coming.
So the Sunday before school started, I was in the hospital.
Emily Priest, a teacher based in Edmonds, had eaten takeout noodles the weekend before. Days later, she felt something odd.
So the first symptom was like this weird sensation of something moving around inside me. I even Googled, what does a parasite feel like? Because it just felt like there's something inside me moving.
By the next morning, Priest felt excruciating pain in her abdomen and went to the ER, suspecting it might be appendicitis.
I couldn't stand up straight. I couldn't walk. So it was just really painful.
The medical team was initially puzzled.
Their first two guesses were that I had either been shot by a nail gun and hadn't told them, or that I was a sewer and I'd swallowed a needle.
A CT scan later, doctors confirmed Priest had unwittingly swallowed a wire bristle from a grill brush, a tiny thing barely longer than a penny.
We saw a small, likely metal object that was actually perforating through her stomach.
Dr. Shelby Ryder is a general surgeon at Providence Swedish Edmonds. She operated on Priest to get the bristle out. It's a case she has seen 3 times so far in her 8 years of practice.
It can lodge anywhere in the gastrointestinal tract. Most common is probably the throat or the oropharynx area. But it can be, esophagus, stomach, small or large intestine.
Such cases are documented nationwide. A 2016 study out of the University of Missouri Medical School estimated about 1,700 cases were reported between 2002 and 2014. The American Medical Association has also urged caution when using grill brushes due to safety risks. If left untreated, it can be life-threatening.
So if your stomach or your small or large intestine got perforated, you could get very sick, septic, and septic shock obviously is life-threatening. Fortunately, most patients will have pretty severe symptoms that prompt them to come to the ER and get treatment.
There are alternatives to wire brush tools to clean griddles and grills, like scrubbing with a ball of foil or a heavy-duty sponge.
I know they have some better designs than they used to. And obviously, if you are going to use one, you do need to look at the grill really closely.
Priest declined to specify where she got the affected takeout. She was told the place stopped using grill brushes after the incident. As she fully recovers, Priest wants others to be aware.
If you're a restaurant owner, I would encourage you to throw away the grill brush and use something different.
To see all of our HealthLink coverage, you can text the word HealthLink, all one word, to 206-448-4545, and we'll send you a link. I'm Christine Pei. Thanks so much for watching.